In today's episode, we're talking to Andrew Davis. He is a clinical psychotherapist at Pacific Integrative Psychiatry, and we're going to be talking about why you should see a therapist. And if you want to learn more about how to improve your mental health, go ahead and subscribe to this channel. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine, and I'm the founder of Pacific Integrative Psychiatry. And we see adults with anxiety, depression, and sleep issues all across California, and we also provide nutrition services for mental health. And Andrew provides psychotherapy services for us. So, Andrew, I'm really excited to hear from you today about your approach to psychotherapy, but I'd love to start by learning more about why you became a therapist. What drew you to psychotherapy?
Sure. First of all, excited to be here and along with the team, and looking forward to all the great stuff we can do here. The things that drew me to being a therapist are like a lot of people, my life experiences kind of shaping me to not just be open to therapy. So a lot of it has been my own work that I've done. A lot of my own personal experiences have led me to seek this kind of path, but also, really appreciating and valuing being able to support people on their journey, on their process. I had a brief detour as an elementary school teacher, and pretty quickly found that the part about the job that I really liked was being on the yard duty at lunch and being able to kind of help the kids when they're going through something challenging. And that was an important process too, of me really landing on a path that felt like it really resonated with me.
Yeah, and it's so interesting how many of us maybe don't intend to go into mental health initially.
Sure.
But we kind of take these paths where we have these different experiences, maybe our own experiences interacting with therapists or other mental health practitioners, our own anxiety, burnout, and stress that many of us deal with, and then seeing how we interact with other people. So yeah, it's just really interesting to hear you were a teacher at first. I didn't realize that.
Mm-hmm. Yeah. And I think like anything, all those experiences, even the ones that don't work out in the way we want them to, right, are useful and can teach us lessons that can be incorporated if we're willing to confront them, right? And it's not always easy, but it definitely was essential in me getting here, and has made me a better person and a better therapist, I think.
Yeah, and so for people who are listening, I know a lot of folks will say, well, I don't really need to see a therapist. I can just talk to my family, talk to my friends. I have a good support system. Why should I see a therapist? So what do you recommend to people? Like, why should they see a therapist? What's their deal about?
Yeah, I think there are a lot of ways that it can be positive to be able to utilize our social support systems, whether that's family or friends. Sometimes there are also some limitations to that, right? Everyone, even from just beginning of training, right, and education, right, people can be supportive as family members, but might not have the background to help out in a way that might be needed, right? People also might have a variety of their own biases, life experiences that might filter what kind of support they're able to give or willing to give, that might not necessarily match up with the kind of support that someone might need or want or benefit from. The other part too is, in my work with clients, I also make sure to, if family and friends are able to support and willing to, and that's something that client benefits from and enjoys, I think that's important to incorporate and not also throw out. Doesn't have to be only a therapist or family and friends. Lastly, too, only kind of relying on family and friends as support might be difficult under certain circumstances if the particular person seeking help has any sort of anxiety, trauma, or challenges relating to those people, right? So there might be times where those might not be the most appropriate people to go to in those situations if they've had some involvement in some of the reasons someone is seeking help. So there are a lot of reasons why therapy can be unique. One last thing I'll say too is there's something unique about the therapist and client relationship. Part of it being it isn't totally two-sided, right? Me as a therapist, we're holding space for you and supporting you, and that's part of the reason it works, right? So those are kind of a variety of reasons why therapy can be helpful, often in addition to any support you might get from friends, family, peers, colleagues.
Yeah, I think that's a really helpful way to frame it, is that it's not a replacement for talking to your family and friends, but it's just a different kind of a support in a really unique space. Like you said, like it's just for you, just for the client.
Yeah.
So what is therapy? I think some people who haven't seen a therapist before Sometimes there's an idea that as well as just talking to somebody. How is that really going to help me?
Sure.
So what exactly is psychotherapy? What might happen in a session?
Yeah, I think therapy can look different for a lot of different reasons, depending on the therapist, the client, the situation, and the need. When working with me, therapy looks like a combination of the client talking, sharing their experience, a lot of me listening. I ask a lot of open-ended questions, right, kind of aimed at helping someone kind of gain some insight or become aware of certain things. The amount of times client has maybe becoming aware of something by a question I asked and gone, wow, how did I not see that before, right? So there are these things that are really hard to put into words of how it works. It's kind of a really unique experience that it's hard to really describe, right? But in the end, I focus on doing therapy in a way that that particular client would benefit from. You know, I don't have a template that works for everyone. And I really pride myself in being flexible and really catering towards the need of the client, right? Someone who has not been in therapy before might not need or want a little more structure, whether that's me leading the session a little more than them. They might want some kind of homework or tasks to do in between sessions. So I really make a point to ask the client and really kind of frequently check in to see how they're feeling about the work, about the style, and being willing to make any adjustments necessary, whether that's things that they recommend or things that I might notice, and really working collaboratively with the client to do so.
Yeah, and I think that's really helpful for people to recognize, because the research even shows that there's not one type of therapy that's better than another. It's really about the relationship you have with your therapist that matters. And
absolutely.
And it's just about that personalized approach. Some people want more of a structured cognitive behavioral therapy, CBT approach. Some people want more of an open-ended back and forth conversation. And so tailoring it to the client is really what matters.
Yeah, absolutely.
So what do you say to people who might complain that, you know what, I've done therapy before. I've been in therapy for years. I've seen tons of therapists. It hasn't really worked for me.
Yeah.
What would you say to somebody like that?
Sure. Yeah, I have current clients or past clients that who have had similar experiences, and I happen to actually enjoy and have found a lot of success working with those kind of clients. You know, what I say is I first make sure to recognize and validate that experience and how disappointing and frustrating that might be to have put in a lot of work, time, energy, money, and not feeling like someone has gotten the kind of benefit out of it that they would have hoped, right? I also tell people there are a lot of reasons why that happens. The therapist and their qualifications, the client and where they're at in their life and their willingness or ability to do the work, and also the match, right? Sometimes it might be a great therapist, but it's a great therapist for that person 5 years down the line or 5 years beforehand. So there are a lot of factors that influence that. And sometimes it does take trying a couple different therapists, a couple different styles, a couple different points in someone's life to really find that match. And I also know that process can be pretty frustrating and discouraging sometimes. So, you know, I really make sure to kind of hold space and validate that, and be transparent with the client that, you know, we're going to work together. I'm going to do all I can to support you and making sure that we're giving the kind of support that you need. And in my experience as a therapist, that's often been helpful. And I've had clients who have had really kind of at their last, pretty much getting ready to be done with therapy and feeling pretty hopeless about it, and who have really felt good about the work they've been able to do in our dynamic, and I really appreciated that. So to anyone who's a little unsure or who has had some not great experiences, you know, as frustrating or challenging as it might be, I really encourage you to see what it's like to consider giving it another shot, and maybe even thinking about, are there any of those factors that may have contributed to it not working out in the way that you would have hoped? And what are some reasons why this might be different, or this could be different this time?
That's really helpful. And I really like how you put that maybe, you know, like at different points of your time and at different points in time of your life, you might need a different approach, and working with a different person can be really helpful just to get a new perspective and just a different way of looking at things. So what are some tips that you might recommend generally for people who maybe they're not struggling necessarily with any severe symptoms, but I mean, we all have mental health to take care of. Right. And many of us are stressed out or anxious or burned out or a little bit depressed. And I think the pandemic really highlighted a lot of that. So what are some
Sure.
mental health tips that you might recommend to anyone who's listening today?
Sure. I mean, I think that's a great point you made too. Before I get to answering your question directly, that therapy isn't just for people who are immensely struggling or who have a previous diagnosis, or therapy can be for people who just feel stuck, feel frustrated or disconnected, or so being aware too that someone doesn't have to be really in the pits, in the deepest hole to consider or even want to seek out therapy, right? To answer your question, though, some things that I really kind of focus on with my work, but also just suggesting to people when they ask, right? Really focusing on self-compassion, which can be hard for a lot of people. Being kind to yourself. Sometimes being kind to yourself means being a little more gentler, giving yourself a break. Sometimes being kind to yourself means like giving yourself a little nudge to get going, right? Being kind doesn't mean letting yourself off the hook. So that can look really different. Balancing that accountability, but also being kind to yourself. Knowing when to ask for help and in what ways and to who, right? Sometimes it is helpful to practice and learn to do things on your own. Sometimes it's actually maybe more helpful to seek out support. But also being mindful of who in your life is able to support you in the way that you're seeking, right? Someone might go to their best friend for something, their mom for someone else, a mentor, a professor, right? And some of that is their roles that might impact that. But also, if someone knows this friend is really good at listening and this friend is really good at giving advice, being mindful of what is the kind of support that I'm seeking and what's the best chance of me getting that from someone in my life. And lastly, working on creating balance, and that can mean a lot of things, balance between physical health and emotional health, time with yourself and time with friends, work, life, this idea of balance and having balance in a lot of areas of our life. A lot of times people seeking therapy maybe have some aspects of their life or a lot of aspects that are out of balance or out of sync. So considering that as a factor in someone's kind of wellness or just overall enjoyment and connection to life.
So many great points there. And just to kind of emphasize again, what you were saying is that you don't have to be in dire straits to go seek therapy and to benefit from it. There are lots of benefits that someone can experience from therapy, especially when you're doing well. It's also a way to help maintain and optimize your mental health.
Right. Yeah. And, everyone uses therapy differently and needs it differently. For some people, it is like some people go to the doctor every, year for an annual physical. Some people like going to therapy every week to kind of maintain their progress, or to, some people need more concrete skills or tools or insight. And, as a therapist, my job is to be sensitive to your specific situation and help you as a person, right? As a whole person, not as a diagnosis or symptom, and treating you as your person with the experiences that you've had.
And I also really like how you shared about figuring out what your needs are. And if you have a friend who gives, do you need someone to listen to you? Do you want advice?
Mm-hmm.
And the way that I sometimes frame it to people is thinking about your own personal board of advisors.
Yeah.
Who do you want on your board of advisors? And what kind of therapy support would you want to include in that?
Yeah, absolutely.
What are some things, I'm just curious, what are some things that you do for yourself to support your own mental health?
Yeah. In full transparency, I do my own therapy. It's pretty important to me as a person, as something that's led me to this path, and also to continue being a functioning person and who can thrive and enjoy life, and also be a good therapist for other people. So that's a big factor for me. I really enjoy and appreciate regular exercise. Do my best to eat balanced nutrition, right? So that doesn't mean I'm the healthiest eater ever, but the balance, right? Allow myself to have a cookie, right, or more than one cookie, but also getting a glass of water, those kind of thing. I do my best to get some quality sleep, and then also playing music is a big tool for me, and having an outlet for both creativity and emotion, but just taking a break. Playing with my dog and spending time with my wife and family are all really important aspects that allow me to be the most functional and optimal version of myself.
Yeah, and I think that's really great to hear, because, as health practitioners, and I often say this to other healthcare practitioners too, is that it's important that we practice what we preach, right?
Sure. Yeah.
That we walk the talk. And
Yep. Absolutely.
yeah, and I can echo a lot of the things that you just shared. Just for me personally, I also see a therapist. I went back to therapy recently to just for extra support. And I think it's something that everyone can benefit from. And also emphasizing sleep and exercise, movement, fresh air, sunshine, hydration, nutrition, all of these things do have a big impact. Yeah.
One last thing that I forgot to mention that is not just often a part of my work with clients, but my own personal work is mindfulness. That can sometimes be in the form of sitting down to do a mindfulness meditation, but also it could be doing some stretching mindfully, going on a walk mindfully, listening to a song or eating a meal mindfully, having those moments. And again, it doesn't have to be for long chunks of time, a couple minutes here and there of really actively practicing being in the present moment, accepting the present moment without judgment can be really helpful. And that can mean my present emotional or internal state. That can mean the circumstances of the larger world and global and political issues. It could be the weather, right? But this real practice of accepting of what is has been really helpful in my connection to myself and the world around me.
So what kinds of patients do you work with? I mean, there's a lot of tools and skills and support that you can offer people. So what kinds of patients do you work with at Pacific Integrative Psychiatry?
Yeah, I work with adults who are dealing with issues relating to anxiety, depression, trauma, also issues related to codependency, boundaries, people who maybe feel like they're people pleasers is a term that people use sometimes, or having trouble putting yourself first. You may be kind of chronically finding yourself in a position of feeling like your needs aren't getting met. So I really enjoy helping clients kind of identify some patterns and developing tools to start feeling more empowered to put themselves first, right? In a way that feels uncomfortable at times. So I also, like I mentioned earlier, really liked working with clients who have really struggled to find some therapy in the past that has really kind of helped them in the way that they're seeking. And at times, I also like working with people who are creatives, whether that's people who are in the creative industries as far as work or just hobbies. And kind of that kind of person is someone that I'm familiar with, and as a creative person, I really value that. And that it can often be used as a part of someone's resilience or practices and helping them, become the person they want to be.
So if people are interested in working with you or learning more about how they can work with you, what's the next step?
Sure. Yeah, I'm available to take on clients here at Pacific Integrative Psychiatry. You can contact us on the website, but that's where you can find me.
Fantastic. And we see patients by telemedicine all across California. So wherever people are located in the state, as long as you're in California, we can work with you. And as Andrew said, you can schedule a call via our website. You can schedule a free call with our team, and they can help you figure out if we're the right fit for your needs. And you can also email us, but check out our website, pacificintegrativepsych.com. So thanks, Andrew. This is really informative, really helpful. So thanks for taking the time today.
Absolutely. Thank you.